NHA CCMA Exam Prep 2026. Question 1. A CCMA is performing hand hygiene. How long should they scrub their hands? 5 seconds, 10 seconds, 20 seconds, 45 seconds. According to CDC guidelines, hands should be scrubbed with soap and water for at least 20 seconds to effectively remove pathogens. This duration ensures proper removal of dirt, bacteria, and viruses. Hand hygiene is the single most important infection control measure in healthcare settings. Question 2. Which of the following requires contact precautions? Tuberculosis, influenza, MRSA, prostatitis. MRSA, methicillin-resistant Staphylococcus aureus, requires contact precautions because it spreads through direct contact with infected patients or contaminated surfaces. Contact precautions include gown and gloves. Tuberculosis requires airborne precautions, influenza requires droplet precautions, and prostatitis is not an infectious condition requiring isolation. Question 3. Where is the apical pulse located? Midsternal line, 5th intercostal space, midclavicular line, 1 inch below the clavicle, right sternal border. The apical pulse is located at the 5th intercostal space at the midclavicular line, directly over the apex of the heart. This is the most accurate location for assessing heart rate and rhythm, especially in patients with irregular pulses or certain cardiac conditions. Medical assistants should auscultate using a stethoscope for 1 full minute. Question 4. Which tube is used for PT/INR testing? Lavender top, blue top, red top, gray top. PT/INR, prothrombin time/international normalized ratio. Testing requires a light blue top tube containing sodium citrate. Sodium citrate preserves coagulation factors by binding calcium, which is essential for accurate clotting studies. The proper blood-to-additive ratio, 9:1, must be maintained, so the tube should be filled completely. Question 5. A patient reports polyuria. This refers to what? Excessive thirst, frequent urination, painful urination, blood in urine. Polyuria means frequent or excessive urination. Poly- means many or excessive, and urea refers to urine. Polyuria is a common symptom of diabetes mellitus, diabetes insipidus, and other metabolic disorders. It differs from polydipsia, excessive thirst, dysuria, painful urination, and hematuria, blood in urine. Question 6. What angle is used for a subcutaneous injection? 15 degrees, 25 degrees, 45 degrees, 90 degrees. Subcutaneous injections are typically administered at a 45-degree angle or 90-degree with adequate skin fold to deposit medication into the fatty tissue layer beneath the skin. The needle length and patient body habitus determine the exact angle. Common sites include the abdomen, thighs, and upper arms. Question 7. Which of the following is part of the chain of infection? Portal of entry, clean gloves, PPE, HIPAA. The chain of infection includes 6 components: infectious agent, reservoir, portal of exit, mode of transmission, portal of entry, and susceptible host. Understanding each link helps healthcare workers break the chain and prevent infection transmission. Portal of entry refers to how pathogens enter a new host, such as through mucous membranes or broken skin. Question 8. The CCMA should place V6 in which location? Midclavicular line, anterior axillary line, midaxillary line, sternal border. V6 is placed at the midaxillary line at the same horizontal level as V4 and V5 on the left side of the chest. Proper electrode placement is essential for accurate EKG tracings. V6 is one of the 6 precordial leads used to assess the heart's electrical activity from a horizontal plane, helping detect lateral wall abnormalities. Question 9. Which form is used to submit insurance claims? CMS 1500, OSHA 300, CMS 100, W2. The CMS 1500 form is the standard claim form used by healthcare providers to bill Medicare, Medicaid, and most private insurance carriers for professional services. It contains patient demographics, diagnosis codes, ICD-10, procedure codes, CPT, and provider information. The UB04 form is used for hospital facility claims. Question 10. A CCMA suspects a patient is experiencing hypoglycemia. Which symptom is expected? Flushed skin, confusion, rapid breathing, rash. Hypoglycemia, low blood sugar, causes confusion, dizziness, sweating, weakness, and hunger due to inadequate glucose supply to the brain. Hypo means low, GLYC refers to sugar, and emia means blood condition. Severe hypoglycemia can lead to loss of consciousness and requires immediate treatment with rapid-acting carbohydrates. Question 11. Where should the CCMA inject a PPD test, TB test? Intramuscular, subcutaneous, intradermal, intravenous. The PPD, purified protein derivative, test for tuberculosis is administered intradermally, just beneath the top layer of skin, creating a small wheal. It is read 48 to 72 hours later for induration, hardening, not redness. Intradermal injections are given at a 10 to 15 degree angle using a tuberculin syringe with a small gauge needle. Question 12. What should the CCMA do first when preparing to draw blood? Apply tourniquet. Identify the patient. Choose needle size. Clean the site. Patient identification is always the first step before any procedure to ensure you are drawing blood from the correct individual. Use 2 patient identifiers, e.g., name and date of birth, and compare with the requisition and wristband. This prevents potentially life-threatening errors such as misdiagnosis or incompatible transfusions. Question 13. Which EKG artifact is caused by a frayed wire? Wandering baseline, AC interference, interrupted baseline, somatic tremor. A frayed wire causes an interrupted or broken baseline on the EKG tracing due to intermittent loss of electrical signal transmission. This appears as sudden drops or spikes in the tracing. Wandering baseline is caused by poor electrode contact or patient movement. AC interference is from nearby electrical devices. Somatic tremor is from patient muscle movement. Question 14. A patient with COPD is most likely to have which symptom? Bradycardia, chronic cough, excess saliva, low WBC count. COPD, chronic obstructive pulmonary disease, commonly presents with chronic cough, sputum production, wheezing, and shortness of breath due to airway inflammation and obstruction. The cough is often productive and persistent. COPD is a progressive disease typically caused by smoking or long-term exposure to lung irritants, leading to difficulty exhaling completely. Question 15. Which position is used for rectal temperature measurement? Supine, Fowler's, Sims, Trendelenburg. The Sims position, left side lying with right knee flexed, provides optimal access for rectal temperature measurement while maintaining patient comfort and dignity. This position also facilitates other rectal procedures such as enemas or suppository insertion. Supine is lying flat on back, Fowler's is sitting upright, and Trendelenburg is feet elevated above the head. Question 16. An example of an open-ended question is, are you in pain? Rate your pain 1 through 10. Where does it hurt? Does it hurt here? Where does it hurt? Is an open-ended question because it encourages the patient to provide detailed information using their own words. Open-ended questions cannot be answered with a simple yes or no and help build rapport. They allow patients to express their concerns fully, leading to more comprehensive assessment and improved patient satisfaction. Question 17. Which needle gauge is best for donating blood? 16 gauge, 20 gauge, 21 gauge, 25 gauge. A 16 gauge needle is used for blood donation because the smaller the gauge number, the larger the needle lumen. Larger needles allow for faster blood flow without hemolysis, which is essential when collecting larger volumes of blood, approximately 450 to 500 milliliters. Standard venipuncture for laboratory testing typically uses 20 to 22 gauge needles. Question 18. A CCMA must obtain a sputum specimen. The patient should cough deeply, spit saliva, avoid coughing, blow their nose. Sputum specimens require deep coughing to bring up mucus from the lower respiratory tract, not just saliva from the mouth. The patient should rinse their mouth with water first to reduce contamination. Early morning specimens are preferred as they are more concentrated. Sputum is used to diagnose respiratory infections such as tuberculosis or pneumonia. Question 19. Which document informs a patient of their rights under HIPAA? Consent form, notice of privacy practices, encounter form, explanation of benefits, OB. The notice of privacy practices informs patients of their HIPAA rights, including how their health information may be used and disclosed, their right to access their records, and how to file a complaint. Patients must acknowledge receipt of this notice. Consent forms are for procedures. Encounter forms list services provided, and EOB explains insurance payments. Question 20. A fasting glucose test requires the patient to fast for 4 hours, 6 hours, 8 to 12 hours, 24 hours. Fasting glucose testing requires 8 to 12 hours without food or caloric beverages. Water is allowed to obtain an accurate baseline glucose level unaffected by recent meals. This test is used to diagnose diabetes and prediabetes. Patients should follow their provider's instructions regarding medication before the test, as some diabetes medications may need to be withheld. Question 21. Which is a sign of shock? Warm skin, low blood pressure, slow breathing, high temperature. Shock is characterized by low blood pressure, hypotension, rapid weak pulse, cold clammy skin, and altered mental status due to inadequate tissue perfusion. Causes include hypovolemia, bleeding, sepsis, cardiac dysfunction, or anaphylaxis. Immediate recognition and treatment are critical, as prolonged shock can lead to organ failure and death. Question 22. What is the normal paper speed for an EKG? 10 millimeters per second, 25 millimeters per second, 50 millimeters per second, 100 millimeters per second. Standard EKG paper speed is 25 millimeters per second, allowing accurate measurement of heart rate, intervals, and waveforms. At this speed, one small box, 1 millimeter, equals 0.04 seconds, and one large box, 5 millimeters, equals 0.20 seconds. Some stress tests or Holter monitors may use 50 millimeters per second for more detailed analysis, but 25 millimeters per second is the clinical standard. Question 23. Which of the following requires airborne precautions? Staph infection, tuberculosis, TB, RSV, C, diff. Tuberculosis requires airborne precautions including an N95 respirator and negative pressure room because it spreads via small droplet nuclei that remain suspended in the air. RSV and staph infections require contact or droplet precautions. C. Diff requires contact precautions with hand washing using soap and water, not alcohol-based sanitizers, due to spore formation. Question 24. Which vaccine is stored in the freezer? Staph, tetanus, diphtheria, pertussis, MMR, measles, mumps, rubella, varicella, chickenpox, influenza, flu. Varicella, chickenpox, vaccine is stored in the freezer at temperatures between -50 degrees Celsius and -15 degrees Celsius to maintain potency. MMR is stored in the refrigerator but must be used within 8 hours after reconstitution. Staph and flu vaccines are stored in the refrigerator. Proper vaccine storage and handling are essential to maintain vaccine effectiveness and patient safety. Question 25. The best site for an IM injection in an adult is deltoid, dorsogluteal, vastus lateralis, ventrogluteal. The ventrogluteal site is preferred for IM injections in adults due to its large muscle mass, lack of major nerves and blood vessels, and low risk of injury. It is located on the side of the hip. The deltoid is used for small volumes, less than or equal to 1 milliliter. The dorsogluteal risks sciatic nerve injury, and the vastus lateralis is preferred for infants.